Hello, welcome back. My name is Mokwani. I'm a hearing aid radiologist, and today we're going to dive into an interesting topic, which is hearing loss in the elderly. It's also called presbycusis. Age-related hearing loss is one of the most common chronic conditions that affect the older adults. It usually happens gradually, and it can affect the ears, like both ears, on the same level, and in some situations there's some slight difference. So you may be having a question like, okay, why does it happen? So we have the natural aging of the inner ear sensory cells. Those are the hair cells and the nerve pathways. And we have the long-term exposure to noise over a lifetime. The third one, it can happen because of genetics. And certain medical conditions such as diabetes or heart disease and some medications can increase the risk of getting the hearing loss. So, how does it affect the older adult? The high frequency sounds are lost fast. This is whereby the so soft voices, the children's speech, the bird songs are harder to hear. And you may find like they have trouble hearing in noise places, or rather noisy situations like restaurants. You may find they have issues with speech, whereby speech may sound as if it's muffled. You may find them telling you more often, I can hear, but I can't understand. They find themselves in most situations asking people to repeat themselves when they're having conversations. And they may withdraw socially due to frustration and embarrassment, which can lead to isolation and depression, because you are in a group of people, you're having conversation, but you're not getting what they're saying. So the best thing is like, oh, let me just go away, let me be myself, because I don't want to keep on asking people to repeat themselves, or rather I don't want to be in a situation where I cannot hear what people are saying. What are the signs that we should watch out for? The first one, if you notice the older adults are turning the TV or radio volume too high, that's a red flag. If you notice they're having difficult hearing on the phone. The third one, if you find them often asking what? Oh, the misunderstanding conversations. You tell them, help me the remote. They go ahead and bring something else that should tell you like something is not adding up, something is happening somewhere. And if they're complaining most of the time that when people are talking to them, they're just mumbling, that's a red flag. And why is it so important for us to address this situation? The first thing, we need to understand that untreated hearing loss in the older adults, it's linked to social isolation, depression, cognitive decline, and dementia risk, increased falls and safety issues. So for us to work on this, let's try as much as we can and see like, okay, it's not hearing loss that is giving us these conditions. And what we can do to help the older adult is that, or rather, if you're older adult, what should you do? We should work on having regular hearing checks, whereby you can do it ideally once a year. Let's get our hearing tested. At least you get to see, okay, this is where we can hear, these are hearing levels. If we need to cap the hearing loss when it's still at a mild level, let's cap it when it's at that mild level. And then we have the use of hearing aids. Good news is that the modern devices, they're very small, they're comfortable, and they help people stay engaged. They help people connect to others. They help people feel part of the community. As families, let's have that support. Let's support the older adults. We should be patient with them. We should speak more clearly. We should face them when having a conversation. And we should try as much as we can to employ communication strategies. We can reduce the background noise when having conversation with them. We should try and have good lighting when having that conversation, and we can use assistive listening devices where there's need. Let's keep in mind that hearing health is part of health aging, and we should encourage regular hearing tests for elderly loved ones. To love is to care. When you're loving them, you're caring for them. If you're caring for them, you're loving them. Let's show that. And early intervention makes a big difference in quality of life. Don't forget to like, subscribe, comment, ask any questions you have regarding hearing health. Let's walk in this journey together until we are able to live in an all-inclusive society. Thank you.